Discrimination permeates various aspects of society, affecting individuals' mental health, opportunities, and overall well being. This episode, accompanying therapy training's anti-discrimination course, equips mental health professionals, counselors, and therapists with essential knowledge to combat discrimination in all spheres of life. We'll delve into the multifaceted nature of discrimination, its impact on mental health, and its manifestations in healthcare, education, employment, and social interactions. You'll gain valuable insights into recognizing subtle forms of bias, understanding intersectionality, and implementing effective strategies to promote equality and inclusion. This comprehensive approach will enhance your ability to support clients facing discrimination and contribute to creating a more just society. Throughout this episode, we will explore the principles of anti-discrimination, the various forms of discrimination you might encounter, and the strategies to effectively challenge biases in yourself and others. We'll also touch on the legal and ethical frameworks that guide our practice in this area and how to cultivate meaningful and respectful therapeutic relationships with clients from diverse backgrounds. So, let's dive right in. First, let's set the stage by discussing the very essence of anti-discrimination. At its core, anti-discrimination is about promoting equality, inclusion, and respect for all individuals, regardless of their race, gender, sexual orientation, ability, or any other characteristic. As mental health professionals, it's our responsibility to provide care that acknowledges and respects the diverse experiences of our clients. This is not just a moral obligation. It is essential for effective therapy. When clients feel understood and respected, they are more likely to engage fully in the therapeutic process and achieve better outcomes. One of the key objectives of the course is to develop awareness and sensitivity to the different forms of discrimination that exist. Let's take a moment to reflect on that. Discrimination can manifest in many ways, including racism, sexism, homophobia, and ableism. Each of these forms of discrimination can have profound implications for mental health and well-being. For instance, consider the impact of racism. Research consistently shows that individuals from marginalized racial and ethnic backgrounds experience higher rates of mental health issues due to the chronic stress associated with discrimination. As practitioners, it's imperative that we recognize these challenges and approach our work with cultural humility. What does cultural humility mean? It means acknowledging that we don't have all the answers and that we must continually learn from our clients' experiences. It invites us to step back and assess our biases and assumptions. Are there stereotypes that you find yourself grappling with? Perhaps you've heard certain phrases or assumptions in clinical settings that just don't sit right. These are the moments that prompt us to examine our beliefs, to ask ourselves, what biases might I be carrying into this session? This leads us to the second main point: acquiring the knowledge and skills necessary to challenge biases and stereotypes. It's not enough to simply acknowledge that discrimination exists. We must actively work to identify and dismantle our own biases. Engaging in self-reflection is a powerful tool. For example, consider keeping a journal where you document your thoughts and feelings after client sessions. This can help you notice patterns in your thinking and identify any moments where biases may have influenced your interactions. Let's also discuss the practical application of anti-discrimination strategies within assessment and treatment plans. The course emphasizes tailoring interventions to meet the unique needs of diverse populations. This means developing a flexible approach to therapy that considers cultural factor, socioeconomic status, and individual experiences. For instance, if you're working with a client from a different cultural background, it's essential to ask about their cultural beliefs and how these might influence their mental health and treatment preferences. Imagine a scenario where a therapist assumes that cognitive behavioral therapy, or CBT, is the best approach for everyone. While CBT is a highly effective treatment for many, it may not resonate with clients who come from non-Western cultures that prioritize community and familial connections. In these cases, integrating family therapy or community-based approaches may be more beneficial. It's about customizing our therapeutic modalities to reflect the unique tapestry of each client's life. Now, let's pivot to the legal and ethical frameworks surrounding anti-discrimination in mental health practice. Understanding these frameworks is not just about compliance. It's an opportunity to advocate for your client's rights. Familiarizing yourself with laws related to discrimination, such as the Americans with Disabilities Act or Title VII of the Civil Rights Act, equips you with the knowledge to navigate complex situations. For instance, if you encounter a situation where a client feels they are being discriminated against within a healthcare setting, knowing the legal protections available can empower you to advocate on their behalf. This advocacy can take many forms, from providing support in navigating the healthcare system to referring clients to resources that can help them address discrimination they face in their lives. As we explore these topics, let's also address some common misconceptions about anti-discrimination in mental health. One misconception is that discussing discrimination and bias is only necessary for those working with marginalized populations. In reality, everyone can benefit from understanding these concepts regardless of the demographic they serve. Discrimination affects us all, and recognizing its prevalence in our society is crucial for creating inclusive spaces. Another misconception is that once we've completed training on anti-discrimination, we are done learning. In truth, this is an ongoing process. Cultural competence and anti-discrimination work require continuous reflection and adaptation. Just as our clients grow and change, so must we. Engaging in regular training opportunities, like the course offered by Therapy Trainings, is one way to stay informed and committed to this vital work. Now let's take a moment to reflect on how we can foster open dialogue, active listening, and empathetic understanding in our therapeutic relationships. One effective strategy is to incorporate open-ended questions into your practice. Instead of asking, "Do you feel safe in your neighborhood?" you might ask, "Can you share with me what your neighborhood feels like to you?" This slight shift not only invites more profound responses, but also demonstrates your genuine interest in their lived experiences. Additionally, active listening is a skill that can't be overstated. It involves being fully present in the moment and validating your client's feelings. Simple phrases like, "I hear you," or "That sounds really challenging," can go a long way in building trust and rapport. Remember, clients who feel heard are far more likely to engage in the therapeutic process. As we wrap up, I want to leave you with some thought-provoking insights. Anti-discrimination is not just a buzzword. It is a fundamental aspect of our ethical responsibility as mental health professionals. By committing to ongoing self-reflection, challenging biases, and integrating anti-discrimination strategies into our practice, we not only enhance our effectiveness as therapists, but also contribute to a more just and equitable society. I encourage you to take what you've learned today and apply it to your practice. Visit therapytrainings.com to explore more courses and resources that keep up and support your journey toward anti-discrimination and cultural competence. The work we do is more than just a profession. It's a powerful opportunity to make a meaningful difference in the lives of our clients. Thank you for tuning in today and for your commitment to providing equitable and inclusive care to all. Together, we can create a world where everyone feels valued and respected. And that starts with us.